Hello everyone, I'm Anita Wallace, I'm Chair of the Lymphedema Support Network, and I'm delighted to introduce you to Professor Dominic Furniss, a microsurgeon with a special interest in lymphedema. So we talked about the surgical interventions, but the big question is, will they ever be available on the NHS?
Well, this is a question, Anita, we get asked all the time, and I feel great sympathy for the hundreds of thousands of lymphedema patients out there who can't afford to come and have these procedures done privately. We have tried. We've tried locally for at least 5 or 6 years to try and get these procedures approved and available on the NHS. The problem is, well, it's twofold, really. The first one is that the NHS doesn't have a huge amount of money. And it's shrinking, if anything, the amount of money, certainly in real terms. And, with extra pressures from COVID, etc., it's even more difficult to get new procedures accepted on the NHS. One of the main issues with it not being accepted is the way that NHS hospitals are paid for the work that they do. And there's a system of coding which doesn't really have a code for LVA and lymph node transfer and things like that. And so the code that it comes under actually only gets the hospital something like £1,800 for doing a 2-consultant 4 to 6 hour operation. Now, running an operating theatre costs about £1,000 an hour. So immediately you can see that the hospital is losing money in doing that operation. And, our managers would much prefer me to do 2 carpal tunnel decompressions, which would take me about 45 minutes and would get them exactly the same amount of money as doing LVAs for 4 hours with another consultant doing it with me as well. So that's the economic side of things. I noticed as well, one of your members has asked about if they wanted to try to get, for example, life in the NHS. How would they go about it?
Yes, absolutely.
Yeah, so again, that's a really good question. And the NHS runs something called an individual funding request, so an IFR. And it's a big form to fill out. And usually your GP can help you fill that out to try and get approval, special approval from your local health board. So currently CCG, but I noticed in the news that CCGs are going to be disbanded soon. So there will be another health board that runs this. They have the power to sort of override the current regulations and say, yes, this patient deserves this treatment. Now, the difficulty that lymphedema patients have with this is that lymphedema is not rare. It's relatively common. Maybe 150,000 to 250,000 people in the UK have it.
Oh, Dominic, we're quoting over 400,000.
Maybe that many.
Yeah.
I think, there aren't really great studies on the exact prevalence, but certainly it's not rare. And in order to qualify for treatment for a condition that isn't rare, you have to prove that you are somehow different to everyone else who has the same condition. So you have to prove a special case for you personally. And that is very difficult to do because, as we know, most lymphedema patients are actually very similar to each other. And being extraordinary in this sense is very difficult to prove. And so our experience, we've had quite a few patients say, right, I'm going to fight for it. I'm going to try and get the NHS to pay. And our experience is that almost universally that is not possible. So I'm sorry to be slightly pessimistic, but I think it's important to be realistic as well.
Oh, no, yes, I do too. I mean, in talking to Dr. Christiana Gordon and Professor Peter Mortimer from St George's, they're finding the same, it's almost impossible. And Vaughan Keeley from Derby, almost impossible to get this special funding, which is hugely disappointing for people, but that's the reality, sadly.
It is. You know, I think if we were speaking in the early 2000s, when the NHS was getting lots of extra money pumped into it by the government at that stage, then this may be an entirely different conversation. But unfortunately, these operations really and this interest from UK plastic surgeons came at a time when the NHS was contracting rather than expanding.
No, it's very disappointing news for people to hear, but that is, I'm afraid, the reality. Thank you.